Hello and welcome to this online course on needle shyness in horses. So I'm Lily, I'm a vet. I've worked in mostly mixed practice since I graduated in 2016. And I've made this course because I see many horses and people struggling with injections, even to the extent that they're no longer possible. Or just that it's very stressful and leads to a lot of worry on the part of both the horse and the owner, and sometimes even becomes dangerous. Um, and there is an ethical way of going about it, a compassionate way of going about improving the situation. So, um, yes, having you and your horse prepared for all sorts of veterinary and husbandry interventions is extremely useful. Um, these kinds of things may be routine and planned for, or they might be unexpected, urgent, or emergency situations. It is possible to prepare for both things. Obviously, not, you don't exactly know what's going to happen with an urgent or emergency situation, but if your horse is generally well prepared for um, being handled in those kinds of ways, it will make the process go a lot smoother. So the kinds of routine interventions that horses need to be prepared for might include annual vaccinations. Mostly those are given by intramuscular injection, foot care, things like dental examinations and rasping. Horses aren't born knowing about these things, and all of these things can worry them quite a lot if they haven't been prepared for them. It's also worth preparing for other types of procedure that wouldn't be done routinely, but if they ever did have to happen, it would be very useful for the horse to have a basic grounding and not to need to be so worried, such as having a foot stood still on a slightly raised block to have foot x-rays taken, having eye drops put in, or again, injections for being sedated for all manner of things. So say, for example, they needed to have a wound stitched or a nasogastric tube passed, something like that. And a few other related things that can be useful include loading and traveling in case hospitalization is needed, and being clipped. So even if you don't ever intend to clip your horse routinely, treating wounds or placing intravenous catheters requires clipping hair away from the area. And the reason I've started with a needle shyness course is for many of the procedures that I've just mentioned, they also need to be carried out under sedation. So x-rays for them to stay still enough, passing a nasogastric tube, having a wound stitched. So sedation provides some pain relief for the procedure, and it also keeps the horse as still as possible so that the procedures are able to be carried out with more precision and accuracy. It can also be safer for the operator, such as a dentist, but that it is a bit of an it depends situation with sedation. It may or may not be safer to sedate a horse in general. We always need to check that their health status allows a sedative beforehand. For certain procedures in particular, it might not be safer to sedate. For example, for foot care, if the horse lacks balance or if they tend to respond by kicking, sedating does not necessarily eliminate that, and some types can actually lead to disinhibition of behavior, so can make those kinds of responses more extreme. Sedation is most effectively given intravenously, usually, although I will talk about this on the course. But the other reason why it's really useful to be able to inject horses is lots of types of pain relief, such as those being used in medical cases of colic, so non-surgical cases, are given by injection. So it is a problem if horses cannot be injected, or if they can be injected, but it's still highly stressful for all involved. In fact, I would go so far as to say that I would like my horses to be okay with having injections, and I would like that to happen not via learned helplessness. So I don't want them to feel like they've given up into submitting to that process. I'd feel it successful if they don't feel traumatized by the procedure and that they're able to be injected again in the future. So each injection doesn't make the future one more difficult to do. Now, that sometimes is out of our hands. If we have to inject something particularly stingy or if they do have something like a muscle irritation reaction or something, they might have found it particularly unpleasant. And sometimes that means that they do become needle shy. And I don't mean all of that to seem overwhelming. So please don't worry if after everything I've just said you feel woefully underprepared. Don't let it take over your fun time with your horse, and the preparation times can be made fun too. So in this course, we'll explore what needle shyness or even phobia are, some aspects of injection technique which can help to alleviate or prevent needle shyness from developing, some possible underlying reasons for needle shyness, and we'll go quite deep into that. So we'll go into some reasons why they might find it particularly aversive. So included in that is some important aspects of pain physiology, and then we will explore some compassionate, ethical, and pragmatic ways of approaching helping needle shy horses. This course might not be enough on its own for cases with really severe needle phobia. So every case is an individual, and depending on what you need to carry out or your overall aim, and we will talk about that as well, you may need more one-to-one help. I can offer that. I do some online sessions, so I can have a look at what's currently going on and see which approach might be the most helpful. Yes, I would recommend watching the lessons in order, because though it might be tempting to skip straight to what can we do about it, the previous lessons are helpful in understanding kind of where you are now, understanding why you've got to where you are now, therefore the best unique situation. And you have lifetime access, so you can go back and watch the lessons in any order as often as you like. There are worksheets for you if you find them useful, and you can submit a video to me, so up to 5 minutes long, of the problems that you're having. Don't set up a dangerous situation in order to video it. You can tell me if it's, if the horse has a really extreme or explosive response to needles, then you can tell me instead of videoing it. So you can submit them via Facebook Messenger on Nurturing Nature Equine. And also don't forget to sign up for a Q&A call. There are a few dates to choose from. If you submit your questions, if possible, at least 24 hours in advance of the call, then I can group questions accordingly. We won't have too many repeats. Looking forward to seeing you in the first lesson.